Modern life is often tough. Maybe it's the car payments or your child's bad report card. Add a serious illness like cancer to that mix and you have a recipe for stress.
They do worry about a lot of things, about what is going to happen with their treatment. Are they going to have side effects? What will be the efficacy of this treatment regimen? And also in the long term, will they have to live always with this situation? Will it recur or will it be cured?
Worries seem to come with the territory when cancer strikes. Studies show over a third of cancer patients report being distressed. And it seems the younger you are, the tougher it is to handle the disease.
Recent study shows that younger patients have more severe psychological reactions than older patients. Probably because it's not as expected in your life when you have a cancer at, let's say, 40 years old, and you're a mother or you're a father and you have a job, and it's not as expected as it is when you get older.
Cancer patients have a lot to deal with: diagnosis, treatment, and an uncertain future.
Stress is likely to appear at every stage of the disease, so at diagnosis, during treatment, and also after treatment.
Treatment. It's a big issue for cancer patients. Some report the side effects may be as difficult to take as the disease itself. But while losing your hair is devastating for some people, others may turn it into a fashion statement.
The reaction to the treatment side effects may vary a lot from one person to the other. So one person may react very negatively to hair loss, and the other one may adapt to it very easily.
Surprisingly for some, the end of cancer treatments is the most difficult time of all.
Several patients actually find it difficult when the treatments end because they feel that they're not fighting anymore. They feel that they're not supported anymore by their medical team. That's when several patients will consult a psychologist or psychiatrist to help them cope with their disease when the treatment is ended.
The stress that accompanies the upheaval of a major illness can wreak havoc on a person's life, and it is difficult to adjust to. This problem, called an adjustment disorder, usually shows up within 3 months of diagnosis.
Adjustment disorders are more common in cancer patients than in the general population, and they're the most frequent psychological problems that we encounter in those patients. Adjustment disorders are disorders that are less severe than major depression or other anxiety disorders, but they are also difficulties that impair functioning. A patient is not able to fulfill his or her responsibilities. So that's a person who cannot work or cannot take care of their children.
It's not unusual that worries are part of the cancer package. But it's when those worries make it hard to live from day to day that action should be taken.
Clearly, a cancer patient should seek professional help when her functioning is significantly impaired and when she feels high levels of distress.
No one can really lessen the difficult times faced by a person with cancer, but there are some approaches that can ease the anxiety.
There are several resources that are available to cancer patients. Support groups may be helpful for some patients. Individual intervention with a psychologist or psychiatrist may be also helpful. It depends on the person and their preferences.
Mental health professionals might try a variety of techniques.
I do believe that psychological interventions are more appropriate for most of the psychological difficulties encountered by a cancer patient. Relaxation techniques may be helpful as well during treatment and also when the treatment has ended. Sometimes they combine relaxation with hypnosis, and sometimes they use cognitive strategies as well.
Sometimes medications can take the edge off a difficult period.
Antidepressants are relevant when there are significant depressive symptoms. The anti-anxiety medications can also be used.
An illness like cancer is a lot to deal with, but most people are surprisingly resilient.
And the more the time goes by, the less severe the psychological reaction or the level of stress. It may appear surprising that most of the patients adapt well to their situation, and it is only a small subset who will develop severe psychological problems such as major depressions or severe anxiety disorder.